Thank you very much. This has been a terrific meeting so far. I hope I'm not going to ruin that. No slides from me. I'm giving you your eyes a rest, but we have raised the question of stigma in almost every session I've been in, so let's get that out of the way. Can I have please a show of hands for everybody who, or anybody who's either work is with cancer patients, or they've had cancer, or they have cancer, or have had somebody very close to them in their family affected by cancer? Yeah, if you could see from what I see, that's quite a show of hands. Thank you very much. I won't go into the colourful and exciting background to this because I don't have time for the network, but the network was launched at London Global Cancer Week in November 2020 as the UK Global Cancer Network. And it didn't take us long. It really didn't take us long to realise it should be the UK and Ireland Global Cancer Network, because we were so impressed and people kept tapping us on the shoulder and saying, what about us? But so impressed with the work that's is being done in Ireland, and every day I'm very grateful that we are now the UK and Ireland Global Cancer Network. The mission of the network is to gather together the people that we can identify who in the two countries who have an interest. These are professionals who have an interest in helping populations with cancer in low and middle income countries. It's primarily. We're kind of being edged towards underserved populations in high income countries, but we're kind of resolute. Let's stick with low income countries because there the need is greatest. And I'll tell you about the need. I've been listening to the HIV statistics, which are awful. I mean, appalling. In comparison, 10 million people die every year from cancer. One person in low-middle income country dies from cancer every 4.5 seconds. According to the statistics I heard last week at the World Cancer Congress, the death toll, the final closing figure for the recent pandemic was 6.9 million over 4 years. For cancer, that was 40 million. So we have quite a problem, and 70% of cancer deaths happen in low and middle income countries, and that's why it's our focus. What we do is, well, an NGO like us tends to do one or more of four things: convening, advocacy, training and research. And convening, yes, we do. We hold annual meetings and regional meetings. We have a newsletter, we have a WhatsApp, and we bring people together and hold them together in a network and inform. Terribly important when you're running a network. Keep the lines of communication going. In terms of advocacy, we meet with policymakers and we organize publications. And we try and keep the people who make the decisions informed on cancer in developing countries. We are not having much luck because there seems to be a block, there seems to be a blind spot on NCDs in the development agenda, and that is something that really does have to be addressed, and it might come up in the panel. In terms of training, we have a very good training project, which is run by Dr. Aileen Flevin at Cork and also our partner in Nepal. It's based in Nepal, and it's been called for by the Nepalese. It's for training pediatric radiotherapy specialists. They have eight radiotherapy centers in Nepal, but very little expertise in treating children with radiotherapy. So the plan is to train 8 clinical oncologists with radiotherapy, and we've done a virtual session, a basic virtual session. Now the next part is actually for them to come to institutions in Ireland and the UK, and that's at the moment what's being fixed. To learn skills and how to do things and what to look for. In terms of research, we've not yet got a research agenda. We definitely want one. I mean, yes, we need one, but actually we want one more than need it because we're already busy and pressed. But we're very interested in research questions, and some of the things some of the sessions I've already heard too have rung bells in my mind. So, for example, most recent one talking about masculinity in sexual health and reproductive health space. Lots of talk, obviously, about pregnancy and sexually transmitted diseases. Not so much about cervical cancer with the HPV and the need to get people vaccinated and for people to understand that contraception, vaccination